it's been a couple of months since my last video. I thought it was probably about time I did an update. So quite a lot's happened in the last couple of months. I have met my oncologist a couple of times, I've started on my treatment, and I've had a birthday, and I started 5k Your Way. So quite a few things really. And I have to say, I was waiting for that moment for everything to fall apart and to have a breakdown. It really just hasn't happened. So I don't think I'm in denial. I think I have accepted my diagnosis, but I'm just feeling really quite positive. I feel quite happy, and I don't feel particularly poorly. I feel tired and I've got a few other side effects, but on the whole, generally I feel quite well. So after I made my last video, I met my oncologist, Dr. Gale, and she is lovely. I just felt really at ease when I met her, and we just had quite a good, frank conversation about renal cell carcinoma, so kidney cancer, my type of kidney cancer, type of treatment options that are available. She wouldn't really be drawn on my prognosis. I did ask her, but she didn't say, she wouldn't give me a figure. But, you know, I know what the statistics say, and hopefully I'll do better than that. She did say she's got some patients that she's been treating for years. So I started on a treatment called sunitinib, or brand name is Sutent, and it's a tyrosine kinase inhibitor. Basically it's a targeted therapy, so this is a therapy that's not chemotherapy, but it works on a specific part of the pathway for tumours growing and spreading. So it's a tablet that you take once a day. You take it once a day for 4 weeks, and then you have 2 weeks off, and then you start again for 4 weeks and have 2 weeks off, 4 weeks on, 2 weeks off. And you take it for as long as it keeps working. So all the time it's working and you're not getting side effects that are too bad, then you can keep taking this drug. So there are some people that have been taking this drug for years. Others, you know, they have a few months, they might have a year, and then it'll stop working. And some people get side effects that mean that they have to stop taking the drug because the side effects are too bad. Luckily, so far, I've had just over one cycle, so I'm on my second cycle now, my second lot of 4 weeks on and 2 weeks off. And my side effects haven't been too bad. So the potential side effects are, like with most cancer drugs, pretty scary. You can get all sorts of problems, from skin problems, problems with your blood count, problems with your hair, with your gastrointestinal system, with your heart, all sorts of potential problems that you might get, and I'm being monitored really closely. But the side effects that I've had haven't been too bad. So my blood pressure has gone up. I've been getting quite itchy hands and feet, which is a common side effect. Some people do get very blistered hands and the skin can start to slough off. Luckily I've not had that, so again, touch wood, so that's not too bad. I've just noticed that my hair is starting to depigment, so it's going white, so my eyebrows, my eyelashes, my hair, I dye it anyway, so you know, whatever. But yeah, I'm noticing that, and my skin's going a little bit yellow, but that's just, it's not a liver problem, that's just one of the potential side effects of the drug. A little bit of nausea, some other kind of gastric issues, but nothing, you know, nothing I really want to talk about on camera. And my blood cell count has gone down a little bit. Now, I did say that when you take this tablet, you take 4 weeks on and then you have 2 weeks off. But sadly, when I got into towards the end of my second week, so when I first started the treatment, I ended up with all the signs of an infection. So I was shivering, my temperature was up, I felt quite unwell, I think I probably had a urine infection. And I ended up going into hospital because the tablets that I'm on can weaken your immune system, and they can make it more dangerous if you get an infection. So I went in and they checked, and my white cell count had dropped. It wasn't at dangerous levels, but it was on the low side. And so what they suggested was that I did 2 weeks on, 1 week off, 2 weeks on, 1 week off. And that's what I'm doing now. And to be honest, that feels quite good, because towards the end of the 2 weeks, the side effects are starting to become much more noticeable. So things like the nausea are getting worse. I'm getting fatigued as well towards the end of those 2 weeks. And I think if I was to take 4 weeks, I'd probably end up getting much more severe side effects. So yeah, so I ended up in hospital. I was only in for a day. They did some blood tests, they gave me some antibiotics, and I came home on those antibiotics. But yeah, since then, I have to say, treatment so far is going okay. I've got another CT scan in a few weeks, so that will be just after my second cycle. So it's the end of May is my next CT scan. So we'll wait and see what happens with that. You know, I mean, if there's no progression, that would be great. You know, so if there's no more new growths anywhere, or the growths I've got haven't got any bigger, that would be brilliant. If they've got smaller, amazing, that would be incredible. I don't know, we're going to have to wait and see. I mean, it is also possible that I've got new tumours growing elsewhere, so I need to be ready for that. Oh, I also had a bone scan. I went in for a bone scan because I told the consultant about this pain that I had in my shoulder. And so we were checking to see if there was any evidence of any growths in any of my bones, but that came back clear, so that's really good. This doesn't absolutely mean that there's no growths in the bones, because they don't always show, but you know, at least it didn't show any. The shoulder it's still painful, but it's not as bad as it was. I have been doing some kind of home physio on that to try and make it better. So whether it's that, or whether there is something growing in there and it's stopped growing, or it's diminishing, who knows. But anyway, that's getting a little bit better. And the lump that I had on my arm here, I can't feel that anymore. That's gone. So again, I don't know if that was something incidental, or whether that was the growth and it's now disappeared. I don't know. I just need to wait for the scan, really. It's all guesswork until I have that scan. Other exciting things coming up. I have a colonoscopy. That's going to be at some point. I haven't got the date for that yet, but I'll be getting that at some point in the next few weeks. So that'll be fun. 5k your way. So I'm not going to talk too much about that, because I'll probably do another video about that later. But I've started up the 5k your way event down here, and I'll put a link in the description underneath the video, so you can check out our Facebook page and you can read all about it. We had our first event at the end of March. It was at our local park run, and there was loads and loads of people came down. Loads of my family and friends were there, but also people that had come that had heard about us. So one lady heard about us from the radio, other people from the internet. So yeah, loads of people came along to that, and it was really, really good. But like I said, I'm going to do another video about that at some other point. I haven't gone back to work yet. I saw my occupational health doctor a few weeks ago. He said that I'm not, at that point, wasn't ready to go back to work, mainly because I'd just started the treatment, didn't really know how it was going to impact me, and I was getting quite fatigued. So I've got next week, I'm going back to occupational health, and I feel quite positive actually that they're going to say that we can look at starting to get me back to work. I am still getting fatigued, but it's nowhere near as bad, and you know, the treatment has been quite tolerable so far. So fingers crossed, we'll see if we can get back to some kind of work. Yeah, so things are pretty good. Feeling well. I'm feeling emotionally. I'm feeling good. I'm feeling happy. Feeling positive. Started treatment. That's going well. Managed to start my 5k your way. Been doing some exercise. So yeah, things are looking up. And I'll try not to leave it too long until I do my next video.